upper body into the heart is going to come from the superior vena cava. And if you notice, all the models, either if they're blue, they're going to be veins because they carry deoxygenated blood is how they're kind of looking at it. And if they're red, they're going to be arteries because they're carrying oxygenated blood. So you have the inferior vena cava, which is blue, superior vena cava, which is also blue. Okay, vena or venous. All right. So now it comes into the heart. There's 4 chambers. The first chamber is the right atrium. Okay. Now, so we have the right atrium. One of the things inside the right atrium, and on this model it's number 55, in the fetal heart, like when you're a fetus, there's 2, in order for the blood to shunt from the mom and all that, there's 2 shunts, or blood to cut, because it doesn't go to lungs and get oxygen, because it gets oxygen from the mom. And so there's 2 shunts in it, and one of them connects the 2 atria. But when you're born, it better close up within hours. Okay, so otherwise you have a little murmur there. But when it closes up, it creates kind of a little scar tissue, and we're going to call that the fossa ovale in the adult, or postnatal. And in this particular model, it's number 55. I can get 5 there. There it is. Right here. Fossa ovale. You'll see that in the right atrium of the heart models. In the fetus, it was a foramen ovale, just like in the skull. So there's 2 foramen ovales, right? In the skull, and now in the heart also. That's the shunt. One of them. I'll get the other when we get to the blood flow up to that point. So right here is the fossa ovale. Okay? That's an adult. Like fossa is a fossil, they're older. Fossa in an adult. Foramen is going to be in the fetus. All right, so now the blood is in the right atrium. It gets pumped into this chamber down here called the right ventricle. And it goes through a valve. We're going to call that the tricuspid valve, because it has, actually you probably see it a little bit better here, 3 cusps. And there's one here, there, and yeah, I doubt you can see that all that well. Maybe you can, I don't want to insult your intelligence, but we have, the tricuspid has 3 cusps. Not only is it called the tricuspid valve, but it's called the right atrioventricular valve. On the right side, connecting the atrium and the ventricle, right atrioventricular valve, or right tricuspid, or not right, because there's only one, or tricuspid valve. Now blood is in the right ventricle. And now, if you notice, the difference between, and this could be very prevalent in the on the cadavers also. See how, now, can't really see it, but there's a lot, this is muscular looking, because the ventricles do all the work. Yeah?
Can you turn like the peripheral lights off?
I can try, see if I can. What are the 2 bulbs, that's it? All right, wait, how about that? I don't want to do that. Is that?
I don't know
Yeah.
if it works or not.
Yeah. Maybe, what if I turn the light off on this thing? Maybe it'll help
Yeah, that.
work.
I just turned it
Turn the
on.
I
light
turned it on.
that, and then
Right.
there's 2 lights off.
Well, it's off right now. You mean like that?
It helped a little bit when you turned that one off.
This, yeah, I did.
Not much, but a little bit.
Anything? Well, anyways, my point was, and you'll be able to see it when you look at the hearts also when you go over it. The ventricles are more muscular because they're doing the work. The right ventricle is not going to pump blood when it contracts to the lungs. Okay, so and from the right ventricle here, blood is pumped up to the lungs to this big vein right here. I'm sorry, artery actually, and there's a little screw-ups in the heart here. So, and it goes through the pulmonary semilunar valve, or pulmonic valve, if you want to put that, that's fine, but it's just called a pulmonary semilunar valve. Now, why am I calling this an artery? Well,
Deoxygenated
okay,
blood.
remember it this way, because this is across the board. Arteries going away from the heart, away, is an artery, regardless of the color of it. It's blue because it's carrying deoxygenated blood, but since it's going away from the heart, it's an artery. Okay? So in the heart and lungs, that's the only time on all the models that they might be a little funky there. Blues are arteries or veins or vice versa. Okay, so since the blood is going away from the heart, this is an artery. Blue because it's carrying deoxygenated blood. It's called a pulmonary trunk or pulmonary artery. I'd go with pulmonary trunk on that one because it's like a trunk of a tree before it splits into branches. Okay, so pulmonary trunk. Now, blood now is going to go to the lungs. Where are my lungs? Well, if you see in here, you can see it better on the other model. There's not this light blue with the, that's part of the airways. But the vessels, is going to be red and it's going to be blue. The reds are pulmonary veins because they're headed now towards the heart with oxygen in it. That's why they're red. But the blue ones are still pulmonary arteries because they're still going away from the heart and getting the blood, oxygen that it needs. So in the lungs, those colors definitely switch on you. So that's why he likes to pinlight them. A blue one is going to be a pulmonary artery. The red ones are going to be pulmonary veins. Okay, so make sure you got that down. All right, and now the blood's coming towards the heart in pulmonary veins, pulmonary veins, and that's why these are red now, because now they have oxygen coming in, and since they're going towards the heart, they're veins, pulmonary veins. And from the lungs, they come into the left atrium. Pulmonary arteries dump into the pulmonary veins dump into the left atrium. From the left, God bless you. From the left atrium, they're going to come into the left ventricle by way of a mitral valve. Anybody heard that one before? Mitral valve. Okay. It's not only the mitral valve, but remember on this side we had a right atrioventricular valve. It's the left atrioventricular valve. So we got a mitral valve, a left atrioventricular valve, or one more word. Another name. Bicuspid, right? So we have tricuspid on the right, bicuspid on the left. If you want to remember, tri has the R in it, that's on the right side. Okay? All right, so now the blood is in the left ventricle. From the left ventricle, now it's going to go to the body. So it goes up through now the aortic valve or aortic semilunar valve. Okay? Get into the aorta. Since the right ventricle pumps to the lungs, the left ventricle pumps to the body. If you had systemic hypertension, your blood pressure is high, you have high blood pressure in your system, which ventricle will get bigger? Chronically, if you have chronic high blood pressure, what ventricle do you think is going to get bigger and why? It is left. How come? Goes to the body, right? If you have high blood pressure, since it's pumping blood to the body, you can expect to see over time, if it's not taken care of, you expect to see, just like when you go to the gym and you lift weights, it's going to get bigger. You get bigger, so does the left ventricle. If you have high blood pressure, it's just going to get a little bit bigger. Not huge, it's not going to be big, but it's going to be bigger than normal, okay? What if you had pulmonary obstruction? Then you're going to see a right ventricle getting bigger because it has to work harder to get the blood through to the lungs. So just a little FYI there to see how the body works. Right now, we're into the aorta, which is this right here. Now, there's an aortic arch, aortic arch, descending aorta. Now it's starting to go down. The whole thing is the aorta, but sections, aortic arch, descending aorta. Now, what I want you to do is remember your ABCs. Why do I say that? Well, A is the aorta. B is the first branch called the brachiocephalic artery. C is a common carotid, but in this case the left common carotid. And apostrophe S. The S, making it plural, is the subclavian or left subclavian. So ABCs, A, aortic or aorta, brachiocephalic, left common carotid, left subclavian. Okay, now if you have a left common carotid and a left subclavian, where are we going to see the right common carotid and right subclavian? Well, so put this up to yourself. You see now, here's the brachiocephalic, it branches. One goes up to the right common carotid, and this one here shoots off towards the shoulder, left subclavian. I'm sorry, right subclavian. So we see the right common carotid and right subclavian. Oh gosh, left common carotid, left subclavian, right common carotid, right subclavian, off the brachiocephalic. Make sense? Mm-hmm. Good? Okay, now the blood goes to the heart, or it goes to the body and does whatever it does. Okay, so now just an FYI here on the back, we have the trachea. And does anybody want to take a stab at what this is? Esophagus. Yeah. Smooth one. I've seen that pinned on the test, either here or in the cadaver. And if you just got to pull back the heart a little bit, and underneath the heart you'll see this smooth tube back there. It actually looks more muscular even, but it's the esophagus. I'll have to point that out when I get to it. Now I told you about there's two fetal things that you have to know which correspond with the adult. But one of them was that fossa valley. The other one is right here. And in the fetus, it was a shunt between the pulmonary trunk and the aorta. Yes, it better close up when you're born, and it closes up, and then it becomes the ligamentum arteriosum. So, but in the fetus, it was a duct, UCT. So we're going to have, it was called the Ductus Arteriosus. Okay, and the reason I'm writing it, because you'll see why I'm writing it in just a second. So we got Ductus Arteriosus. In the adult, or I should say postnatal, is going to be ligamentum arteriosum. Okay, so we have us for the fetus, and we have the M's for the adults. Okay, so ligamentum arteriosum, ductus arteriosus, that's the fetus. Okay, so it's not ductus arteriosum, ductus arteriosus, ligamentum arteriosum. And just like the fossa ovale, over here in the fetus we have the foramen ovale, and in the postnatal we're going to have the fossa ovale. Just like fossils are older, so you got a fossa, and ligament, it turns into a ligament. It's no longer used, it just becomes scar tissue basically, and the ligamentum arteriosum. Okay? So that's the heart. Questions on that?